So One UH is our initiative to bring our newly acquired hospitals and physician practices onto the same core IT platforms that the other existing hospitals and practices use at UH. So in the last couple of years, we've purchased several new hospitals in the area, and they've been running on their existing legacy IT systems. So the next year and a half, we'll be moving all those hospitals over to a single platform, which is the core hospitals platform. So right now, we're really leveraging our partnership with CliniSync to help provide some of those gaps with those hospitals that aren't on the core system so that we can share information more easily. So that's been real helpful with using the community health record and other tools that CliniSync has to offer. Our overall vision is really to use CliniSync as kind of one of our vehicles to drive patient information to our independent physicians. So we have a legacy physician portal that we're trying to phase out that's been around for several years. So as we look at how we move forward and that, we'd like to really incorporate our partnership with CliniSync to offer that community health record as the way for independents can see their patients' data when they come to UH for services. So today we have embedded into our EMR systems the ability to do the single sign-on into the community health record in context of the patient that they're working in. What we're hoping to do is with our independents, because they don't necessarily use our EMRs all the time, is working with CliniSync to get them their own individual accounts set up so that they can have direct access to the community health record and see the information from UH. So we've already have several live results interfaces today with CliniSync. We're trying to look at building upon that. So we're getting ready within the next month to launch our notes interface, which will send the physician office notes that are done in the office directly to CliniSync so that they would be available for providers to see outside the UH network. Again, so if an independent physician refers their patient here to a specialist and the specialist documents in one of our EMRs, that note will now be sent from the ambulatory space into the community health record for that provider to see, as well as looking to see how we can leverage bringing data into our own systems from the state for the patients that are seen outside of UH. So if we have a patient that happens to have to go outside of UH for service, it'd be nice to actually have that data brought natively back into our EMR systems instead of having the provider go out and look for it. So that's something that we've been talking with the folks at CliniSync with about how we can best approach that. How to leverage the integration into the EMRs easier, making that the ability to get notifications directly into the EMRs. So get that notified product coming into the EMR and actually being able to alert the doctor instead of outside of the EMR or through other mechanisms. So I think those are again more stuff that way I think we can integrate into our EMRs and make it more native there. I think the better it will be for the providers. If I was looking to bring in a little more information from the systems, I think the documentation is one piece. I think that's kind of seeing more robust documentation. I think lots of folks send some of their typical discharge summaries and clinical summaries, but I think like us looking to actually put the office note out there and have that available, I think it is good. I know the expansion of the CCD and being able to actually have a discrete problems, allergies, and medications, immunizations, having that data discreetly and available to come in, I think that's strategic as well, especially when we start looking at population health and being able to run those analytics within the EMR, the point of care, and if there are patients that happen to go outside the health system and need to get their flu shot or whatever it may be, but having that information come back into our EMR, and so when we do our population health and look for those gaps in care, that information would be there and it would show up and it would be give them credit for getting that piece of healthcare done.